Hello, have you ever thought about getting a Pomeranian dog? If so, stick around. We have a lot of facts to share about this little nugget. So as you know, I'm Dr. Patt, exotic vet, and I see predominantly exotics, but also dogs and cats. And those who know me personally know that I have a Pomeranian disorder. I've had many Poms in my life. I see a lot of Pomeranians as patients, and so I thought I'd take the advantage of this darling little girl and go over some things we should consider with Pomeranians. This is Honey. And as you can see, she's still pretty small. She's 3 months old and she weighs 2 pounds. Very sweet disposition. Some of the Poms, if they're not socialized well by the breeder, will be a little scared and a little standoffish. She was clearly very well socialized. One of the things you should always consider if you get any breed, small breed dog, is that they can get hypoglycemia or low blood sugar, and that can result in seizures. And so feeding frequency when they're really little is very important. And so I typically will feed my baby Poms 3 times a day, sometimes 4 if they're really little, just tiny meals, but just enough to keep their blood sugar up. The big issue we see is if they're free fed, sometimes they're playing or sleeping and they don't stop to eat, and then we can have a seizure because the blood sugar goes low. So actually give them dedicated meals, make sure that they are eating for you. Pomeranian specific issues. Unfortunately, while I love this breed, they have many specific issues. Not every dog is going to get these, and not every owner will see them throughout the life of their dog. But I want to go over some of the problems that we see with the breed in particular. One of the things that stands out is alopecia X, and we call it alopecia X because it means we don't know what causes it, but alopecia X is progressive hair loss, and it's a very distinctive coat pattern. And as you know, Pomeranians are noted for their big, fluffy, beautiful coats, so it's always very distressing when owners see them start losing their hair. It'll usually start thinning along the trunk or the top line, and they retain the hair on their face and their feet. The tail will get a little rat tail, and usually you start to see the tail thinning before anything else. Whenever we see an alopecia dog, we do a full workup and we make sure there's not another medical problem that we can treat. And then if we have alopecia, we discuss a few different modalities to try to treat the alopecia. And we can go into that in another video, but there are many things that we can try very safely through your veterinarian. The other thing that we always think about in Pomeranians is tracheal collapse. And this is true in other breeds as well. Poodles, Chihuahuas, smaller breeds tend to have more of an issue. The trachea is a C-shaped cartilage ring like this with a soft tissue membrane on the top. And over time, sometimes quickly in Pomeranians, genetically the cartilage weakens and the C flattens out. So instead of being like this, it's like this. And then that membrane pinches down into the trachea and pinches shut. And we hear what's described as a goose honk cough. If you have a Pomeranian that suddenly started coughing and we don't know why, and it tends to be with excitement or drinking, obviously they should go to their vet, but we should get an actual x-ray to look at the trachea. You can see it changing along the course of the trachea. One of the things we do on exam is just very gently rub the trachea when we're examining a Pom and look for what we call an inducible cough. Where that cartilage is weak, if we gently rub the trachea, it'll stimulate a cough. But again, gentle is the key factor here. That's tracheal collapse. Very serious disease, often a progressive disease, and extremely difficult to treat. We do things to strengthen the cartilage. We reduce their weight to reduce the fat in that membrane, which pinches it even more narrow. Some of these dogs, the trachea will go down to 2 millimeters, so it's breathing through half a straw or a quarter of a straw. Medications to suppress the cough, and kind of last stage effects are things like tracheal stenting. And then some other things, the patellas or the kneecaps. So these are the stifles, these little leggies, and they have kneecaps on their stifles just like we do. The kneecaps in small breed dogs in general often sit in a very shallow groove. And the way the kneecap works is you have basically a trough, and the kneecap sits in there and it tracks up and down. In small breeds, that trough, instead of a deep V, is often shallow, and when they bend their knee, it can pop sideways. And you'll often see this as an owner with skipping or hopping or suddenly holding the leg up. And if you see that, you want to get that checked out. And there are things that can be done for that. Again, weight control, huge factor. More weight, more pressure on those knees. So we also see pancreatitis in Pomeranians and all breeds. So a good quality, well-balanced diet. I recommend sticking with the larger brands, not the little tiny boutique brands, because many dogs have been on that food and they've all tested it before your dog has. Probably a good idea. And we try to make sure we don't give unnecessary treats or changes of food, because as we introduce a new food to a dog, they actually have to grow the bacteria to digest that food. So if they don't have that bacteria, we'll often see gastroenteritis. Pancreatitis, however, specifically is associated with fats in the diet. So very high fat treats and high fat meals can lead to more of this. Pomeranians will also get an atypical Cushing's. I kind of think of them from that respect as little ferrets. It's a very similar presentation. And there is a hormonal panel that can be checked if we're starting to see symptoms that are consistent with it. The hair loss can be one of those. It is a treatable condition. So the big thing is with POMs, if there's something a little off, it's different than their normal. This is true of all dogs or all pets. If it's different than their normal, get them checked out. There may be more going on below the surface that we can intervene on early and correct it before it becomes a big problem. One of the other things to consider in any small breed dog, and certainly Pomeranians, is periodontal disease. This little teeny tiny face here with almost no little nose, that's her full nose, has all the same number of teeth as a German Shepherd. And so what that means is those teeth are very crowded in that little face. And crowding of the teeth traps debris and food and results in calculus and periodontal disease. So teach your puppies early when they're young to allow toothbrushing. It makes a huge difference. If you teach it slowly, calmly, gently, you don't force it, it becomes something they'll come to you for, particularly with flavored enzymatic toothpaste. And you can make a huge difference in the dental disease later in life and the number of extractions that Pomeranians often need later in life. Always lift the lip, look at the gums, they shouldn't be red. If you smell an odor, there's a problem going on, we should get that checked out. And as babies, periodontal disease is an issue, even though you wouldn't think so because we have baby teeth, but that's the problem. They often have too many baby teeth. And many times the POMs won't lose their baby teeth, which are called the deciduous teeth. And so we end up with a shark mouth with double sets of teeth. And those trap even more debris. And so if we see that, we routinely will extract those teeth when we spay them, leaving just the adult teeth. Very important to look in their mouth and make sure nothing's going on. And then they can get open fontanelles or soft spots on their head, and that's usually linked to some degree of hydrocephalus. So it's always a good idea on a baby to palpate the head, palpate soft spots. It doesn't mean we're going to have a problem if you feel it. It just means that there is some degree of pressure on this bigger, rounder head. She does not have any. Most of these will, as they grow, close up naturally without a problem. However, some of them don't, and if it's a very big soft spot or opening, I'd be much more concerned. So that's just a few of the facts that I've learned over the years with Pomeranians. I love this breed. They are a wonderful, highly intelligent breed. Many people think of little dogs as just little yippy dogs that can't be trained or taught or educated, and that's not true. Any dog that you bond with can be trained very readily. It just requires bonding with the dog, communicating with the dog in time. As far as training, I recommend clicker training. It's a good way to start. So if you're thinking about Pomeranians, I hope I didn't scare you too much. Just do your research, be prepared for some of their needs just in case. And if you get them, love them well.